My name's David Elson. I'm a knee surgeon working in the NHS at the Queen Elizabeth Hospital in Gateshead, and my private practice is based in at the Newcastle Nuffield Hospital in Jesmond, Newcastle. Well, I've always had a great interest in knees. You could answer the question simply by saying that most patients have got two legs, so there's plenty of custom. But the reality is that knees are quite a complex joint. There's actually three joints in one, which for me always makes it an interesting joint to attend to. It's a really important joint because a lot of weight bearing goes through the knees. And in the words of Baz Luhrmann, you'll miss your knees when they're gone. So yeah, I've always had an interest in knee surgery, and I've always, when I was training, spent a lot of time working for different knee surgeons who gave me quite different slants on how I practice now as an amalgam of lots of other people's philosophies about knee surgery. That's a very good question. I think the most rewarding part of being a knee surgeon is when patients appear genuinely grateful, because you can have a significant impact upon people's lives by restoring function to them. I think a lot of knee conditions are really quite debilitating, and patients do suffer quite a lot when they're struggling with knee pain for different reasons. And if you can reverse that, then they're incredibly grateful, and that has huge impact upon their lives. So I think patients appreciate the time that I spend getting to know them, getting to understand why it is that they've got the problem that they've got. I think it's important that they're appropriately investigated after taking a thorough history and establishing really what's happened alongside a clinical examination. And putting all that together, of course, the important thing is to reach a diagnosis, which is critical to then plan a management strategy for how they might address the condition that they're facing at that point. I think it's important for patients to have choice, so I enjoy trying my best to produce a range of options that patients can then consider, so that they're collaboratively involved in the decision-making process and feel that they're involved in the management of their case at every stage. I think patients appreciate that. That seems to be the feedback that I get from them. It does take time. I have make no apology for spending time with patients, discussing their clinical problems and getting to the bottom of what the issue is, so that we can find a workable solution. So I think patients who attend for a private consultation with me can expect me to spend a little bit of time finding out the details of how they've come to be in the condition that they're in. Quite often, patients will attend after they've had an injury. Other times, it's a more chronic condition. And sometimes patients just have had a chronic condition which has been going on for a number of years, and they just attend for a condition check to find out how bad things have got and what their options are at that particular stage in their life. For me, I try to make the range of options available to them quite broad. So I'm always looking to provide joint preserving surgery wherever possible. That can be a number of different things. It can be a ligament reconstruction for a ligament insufficiency if they've had a ruptured cruciate or something like that. It can be meniscal salvage surgery, so meniscal repair, or sometimes meniscal transplantation if they're struggling with a meniscal injury. And sometimes patients have issues with their alignment being inappropriate for the condition of their knee, and so I would spend some time perhaps adjusting the alignment and the shape of their leg in order to give them some benefit from offloading a damaged part of their knee. All of these things working together in an attempt to try to salvage a joint, but occasionally the condition of people's knees has gone beyond salvageable, in which case I'm looking at performing some form of knee replacement. And I do quite a lot of partial knee replacements as well as total knee replacements. So I would certainly aim to give patients options wherever that is possible.